in the next slides, by the end of this lecture, we will talk about the types of the electrodes. We will see some images, some examples, and we will review all types of the electrodes in brief. The first electrode we want to consider is metal plate electrodes. As you can see in figures A and B in this slide, we use a metal. These parts are made of metal, a specific alloy, for example, German silver, and we cover this part in the first electrode, or this part in the second electrode, with electrolyte gel. In this metal electrode, as you know, metal electrodes are polarizable electrodes. Therefore, these polarizable electrodes need some fixation. Fixation means using some strap, some bands, something like that, to reduce the motion artifact. Remember that. Polarizable electrodes, motion artifact. But non-polarizable electrode has less motion artifact problem. This structure can be used as a chest electrode for recording the ECG, or in cardiac monitoring for long-term recording. Electrodes used in monitoring EMG or EEGs are generally smaller in diameter than those used in recording ECG. Remember that EMG and EEGs electrodes are generally smaller in diameter. A smaller diameter higher impedance. Remember that. In figure B, some of the disc metal electrodes are made of thin foils, and thin foils allow to conform to the shape of the body. For example, recording from the face, from the muscles of the face needs to be flexible. Also, thin layer of material leads to lower cost. Um, okay, disposable foam pad electrodes are one of the most common use electrodes in the field of bioelectric signal recordings. Uh, in this slide, as you can see, the top view and the bottom view of this electrode, the top view, this snap is to connect to the lead wire, and at the bottom view you can see the adhesive part. This adhesive part leads to a good fixation of the electrode on the skin, therefore the motion artifact in this electrode is less than other types of the electrodes. And also the main recording part, as you can see here, the bottom view, this is the gel, and also at the center here we have AgCl part, and also it covers by Cl negative gel, and also adhesive part here, and top view, the snap to connect to the wire, top view, skin tact is one of the best trademarks in this market. I use it. We can use disposable foam pad electrodes in ECG, EMG, and also for rarely EEG. Also, we can use it for EOG, electroocologram. And I should emphasize that the quality of the recorded signal is related to the price of the electrode. If you want to have good recordings, you need to buy high quality, high price. You should pay more price, more money to have the good recordings. Suction electrodes is the other electrodes we will consider in this lecture. This electrode is a common electrode for recording precordial or chest ECG. A metal suction electrode is often used as a precordial electrode on clinical, I emphasize, clinical electrocardiographs. No need for a strap or adhesive because the suction will fix the electrode on the skin and can be used frequently. This electrode is not a disposable electrode. And because of the small contact area, the impedance of this type of electrodes are high, or high source impedance is expected. No strap or adhesive required, precordial ECG or chest ECG, and can be used for short period because the suction will disturb the patient, will disturb the patient's skin. The next type of the electrode is floating electrode. Floating electrode is a good tool for overcome the motion artifact problem. As you can see, we have a cup here, a double-sided adhesive here, one side to connect to the cup, and other side of this double-sided adhesive is for connect to the skin. And inside it, we fill electrolyte, and here the metal disc will record the signals from the body. In other words, the metal disc is swimming in the electrolyte gel. Also, not in contact with the skin and reduce the motion artifact. In this type, in figure C, we have a cross-section view of a disposable electrode for the same purpose, floating electrodes. And as you can see here, we have a adhesive here, a cup. Here is a cup, and under this cup, gel-coated sponge is located, and the disc here is for recording the signal. This is a AgCl type electrode, and also this type will minimize motion artifact. But the price of this type of electrodes is higher than the other types. The next type of the electrodes is the flexible electrodes. Flexible electrodes is used for conform on the skin of the body, and because we have some various shapes on the body, and a flexible electrode will help us to record better on this small and complex surface, for example in corners, on small muscles, on the small locations. Also recording from infants. The infant's limb is small, therefore we need to use flexible electrode to connect correctly to the limbs. And in this figure we have some examples of flexible electrode. The first one, carbon filled silicon rubber electrode. B, flexible thin film electrode, and the cross section of this thin film electrode. As you can see, the size here, the substrate of this electrode is only 13 micrometer, and we have an Ag film coated on this substrate and one AgCl film on it, and we also use electrolyte hydrogel material on this layer, and this hydrogel material is used to hold electrodes to the skin. acts like adhesive. And also this thin film electrodes is suitable for or compatible with X-ray. In brand new thin film electrodes, we have some electrodes compatible with MRI also, and we use it for newborn infants because we don't want to detach the electrodes from the sensitive skin of newborn infants, and for example imaging, and we want to leave the electrodes on the skin of the newborn infants while imaging, because detaching the electrodes from the sensitive skin of newborn infants maybe hurt the skin,